Hello, this is Dr. Dheeraj Masapu. I am a consultant anesthesiologist and specialized in neuroanesthesiology. Today, I would like to talk about a slightly controversial topic, and it might surprise you. It's about the breaks that anesthesiologists take during the surgery. So, many other specialties, mainly surgical specialties, would be thinking that anesthesiologists take a lot of breaks. So, I would like to actually justify in this particular video why we actually take that, and is it allowed according to societies, and what kind of implications it can have on the anesthesiologist. So that is what I am going to cover now. So I would like to show you the draft which I made. So then the number one thing that I would like to tell is the breaks that anesthesiologists take are called as relief breaks. Okay, so that is taken with a purpose which I am going to explain you now. And do surgeons take some breaks? Even that will I'll try to explain this particular video. Okay, so many people think that anesthesiologist's job is actually sitting inside the OT and looking at the monitors. So that is what at least surgeons and other specialty people think, because they don't know what actually we do. So anesthesiologist's job is actually very demanding and very stressful job. Okay, so why? Because there are so many things which can go wrong during anesthesia. Like patient can develop bleeding, patient can develop hypotension, rhythm disturbances, allergic reactions, and malignant hypothermia, and so many complications can happen. And even awareness, we have to prevent awareness of anesthesia by using depth of anesthesia monitor. So all these things we have to prevent basically. So we have to anticipate what is going on. So all these things will put a lot of stress in your brain. Okay, so that is the reason actually the American Society of Anesthesiologists themselves actually recommend breaks for anesthesiologists. These are called as relief breaks. So the reason they recommend break is taking a break during a surgery. They don't specify a duration for that. It can be minutes or it can extend up to 15 to 20 minutes also. The reason for that is it will reduce the stress and fatigue. Okay, so and your the attention and focus will be better once you come back from the break. That is one of the reason, and it will prevent the errors also according to studies. Okay, and it will replenish the energy and hydration. So you can take a break, go hydrate yourself and come back. It will also change your mood and alertness of the anesthesiologist. So that is what all these things have been proven in studies. Okay, after that only American Society can recommend to take a break during this procedure. And also some personal needs like going to restroom, eating something, and taking some medications. If some anesthesiologists are on some antihypertensives or something, they can go and take the medication. So considering all these facts, they concluded that a relief break is a mandatory thing, and anesthesiologists are allowed to take that. So when you are taking a break, then you are supposed to give handover to a very qualified anesthesiologist of your caliber. Okay, that is the most important thing. So there will be a standardized handoff procedure. So where you hand over the patient to a qualified anesthesiologist and then you take a break. Okay, you are not just leaving the patient and going to some technician or something. And second thing is your reach. You have to be very reachable. That is what they recommend. And if something goes wrong, you have to be reachable and you should reach the patient. And these breaks should be planned in advance. For example, you should not go for a sudden break. You have to inform the anesthesiologist that the relieving anesthesiologist maybe priorly that this is the time I want to take the break, so that he will come at that time and he will give handover and he will go for a particular break. Okay, so the timing of it depends on you and that particular anesthesiologist, and there is no specified time duration for a break. Usually it will be 10 to 15 minutes. Okay, and some people take break to be more efficient also, like they can take a break and go outside and take an IV line for the next patient, or perform a block for the next patient, or some people actually have an induction room where they induce the next patient and come back. So these are the things which can also be done to improve the efficiency of the system by doing breaks. Okay, so these are several advantages, and it is not only in anesthesiology, it is also there in airline industry. In airline industry also there are two pilots. So one, because even a pilot is not supposed to focus for a very long duration, so even they take a breaks, because by taking a break, even same concept applies there. Their errors will decrease and efficiency will improve. Okay, because the mood, alertness and everything will change with the breaks. So pilots and anesthesiologists are compared because almost similar job description and similar kind of a profile will be there. That is why the checklist that we follow and the type of the pattern of work that we have are almost similar or compared with the pilots. So that is about the breaks and what guidelines say, and why we take the break. Okay, So I think this is an evidence-based I spoke till now, and what surgeons do also I would like to tell you, surgeons will not take breaks. There is a reason behind that. The reason is the surgeon's surgery by default, if it is started, it should be completed by the same person. Okay, giving a handover of surgery to another person and he continuing and you joining later won't work out. Okay, because surgery is a more complex skill, and if you start the surgery, the planes of surgery only you will know, so you have to finish that. So by default, surgeons actually end up staying with the case from starting to ending. Okay, and if you ask me, then can surgeon also take a break? Yes. Okay, but the thing is, he can't give handover of the patient. He can take a break for some time when the surgery is stable, and then he can take a small break for a restroom or something and come back and continue the surgery. In that way they can take breaks, but not giving handover to some other person. And one more very important thing I would like to tell you is, when anesthesiologist is giving handover, the patient should be stable. Okay, if by chance the patient is unstable or some kind of issue is going on, you are not supposed to give handover at that point of time. That is another very important thing that you need to understand. Okay, to summarize, it is a very important aspect in anesthesiologist's career. It is like taking breaks is very important, and according to evidence you are supposed to take breaks and to rejuvenate and improve your mood. And what they found in other studies is that the planning, coordination, communication between the anesthesiologist also will improve when you take breaks and you work as a team, and the culture of the organization also will be better. So more than working like a one-man army, you actually take help from others, you develop the culture, they also understand how you manage, you learn from them. Basically, when you give handover, you explain how you're managing to another person. When you take handover, he will explain what he is doing in that particular case. In that way, there will be exchange of knowledge also happening parallelly. So even that is very important in a longer run, because everybody's experience and knowledge is totally different when they manage for a long periods of time. So that is another important thing that studies have been found. And that's it, guys. So that is about anesthesiologists taking breaks, and don't stress yourself. Try to have a balanced life in the work also. And thank you very much for following the video till now. Hope you enjoyed the video. Thank you.